Most ACL injuries are what we call non-contact injuries, 70 to 80% of them, and those are when someone has a sudden change in direction. And what happens is their muscles aren't doing the right thing, and all the force of that change of direction goes into the ACL. And if they're not protecting the ACL with muscles, the force is too great for the ACL and the ACL tears. Now, the other 20 to 30% of injuries are direct contact, more likely in a sport like football where someone actually hits your leg, and again, there's a force that's directed right into your knee joint and things give, and usually in that situation it's your medial collateral ligament and then sometimes your ACL along with it. This is the soccer player, the basketball player, and so forth. You know, the sort of the highest incidence is probably in college. You know, the higher level the athlete is competing at, the more they're putting into it, so the more they're putting themselves out there and at risk. It's a pretty high risk in high school, higher in college, and then it starts to reduce a little bit. But there's a lot of people who play indoor soccer who are really just going out and playing indoor soccer a couple times a week, and they're not really doing anything other than that, and they're a pretty high risk for that sort of injury. Skiers are a whole different category of ACL tear. It's a different mechanism entirely, but there are programs. One is called the Acl Awareness Program that teaches skiers to recognize when they're in an at-risk position, and they can reduce their rate of ACL tear by being aware of that. If you hear a pop, literally hear it in your knee, you've probably done something pretty significant. 90% of people who tear their ACL hear a pop. And also if you tear your MCL, you'll often hear a pop as well. So a pop, either you feel a pop or you hear a pop, is a pretty good indicator that you've done something significant. If your knee swells up within a couple of hours or by the next morning and it's very swollen, you've done something significant. So occasionally you will see someone who tears these ligaments, and because they're super coordinated or whatever, they manage to get by, but it's pretty rare. There's the three main tests to look at an ACL. We'll look at a knee to see if the ACL is torn. Both of them are basically pulling the tibia or the leg bone forward relative to the thigh bone or femur. One is called a Lockman test. That's with your knee bent about 20 degrees. And the other is an anterior draw, and that's with your knee bent about 90 degrees. And the other test is something called a pivot shift, and it's basically where you flex the knee and the knee comes in and out of joint. And it only happens if your ACL isn't there.